Could periodontal disease, commonly known as gum disease, be more than just a pain in the mouth? Researchers think so. Recent literature suggests strong links between the oral health disease and cardiovascular disease. Now experts are looking to see how close the links are and how oral health can be improved in the Northern Territory's remote Indigenous communities where many people suffer from the disease.
Good job, you're brushing really well.
It's not something you normally see in the classroom, but on the Tiwi Islands north of Darwin, students at the Muruputianu Catholic School in Nguyu are getting serious about cleaning their teeth.
The children have actually just loved having their own toothbrush, that's theirs, with their name on it, and they know it's going to be there every day and that no one else is going to use it.
Okay.
The private donation of toothbrushes and toothpaste earlier this year allowed the school to kick off the much-needed program.
We had lots of children with problems with their teeth due to some of the foods that they were eating and then not brushing their teeth. And then that becomes a problem in the classroom because you've got children with sore mouths, sore gums and decaying teeth, which is going to make them sick.
So I've got a question for you guys. What do we need our teeth for? Up the back, yeah?
Smile.
To smile. And what's another time? Up the front?
To talk.
To talk, yeah, definitely.
Andrew Packer works with schools across the top end, teaching young children how to look after their teeth.
So if we can maintain good permanent teeth, then it can set them up for their entire life, and that's important in getting jobs and meeting new people and confidence. So what's first?
Circles.
Yeah, these circles. So we're brushing the germs away, and if there's germs on our teeth, there's going to be germs on our gums as well. So we brush in big circles on the teeth and the gums. We believe that oral hygiene practices in remote communities aren't as good as they could be and ideally should be. We're not 100% sure who's brushing at home and who's not. If I ask them, lots of people often say yes because they know that's the right answer, but our dental therapists and our dentists that visit communities would provide evidence otherwise.
Most remote communities don't have a resident dentist and rely on fly-in trips from Darwin practitioners. Dr Chris Hanbury is on his monthly round to Milakapiti. Here, tooth decay, also known as dental caries, can have significant consequences.
As the caries increases and it's not treated, you have social problems, not smiling, and those sort of issues arise. Speech is affected and also eating and nutrition because they can't chew.
Yeah, that's
You go tap, 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 not hurting anymore?
Most dental problems can be treated in community, but many children aren't getting regular checkups and are having to be flown to hospital for treatment.
2.7 has occlusal caries and we have a 2.8. Those kids that come in from the communities that need a general anaesthetic for what we call really rampant early childhood caries, where they may need multiple extractions and multiple treatment for dental caries itself.
Across the Northern Territory, up to 40 children a month are having to have this kind of surgery to remove some or all of their teeth. The bulk of patients are between 3 and 9 years old.
Well, beyond the social cost, there's obviously a financial cost as well to bring children to an area, and then obviously you'd have the theatre time available and the staff that are required to run that theatre and the anaesthetist and all those on costs. So there's a significant cost to that, yes. You know that stuff that sticks to your teeth? It's called calculus. We clean that off. Those gums will look a lot better because you can't get it off with a toothbrush.
It's not just germs on teeth that cause problems. Germs that can build up on surrounding gums can also lead to periodontal or gum disease.
It starts to dissolve the bone which is supporting the teeth, and the gums will bleed quite readily. So usually people will have a little bit of periodontal disease or gum disease if they bite into an apple or they brush their teeth, and you can see a bit of blood. So that's the first stages of it. And the more extreme stages when the teeth are actually quite loose, it's because your heart's got...
Dr Lisa Jameson is researching how gum disease affects heart health.
The other goes lipped up, lipped up.
She's focused her research in the Northern Territory, where there isn't a resident periodontal specialist.
We do a baseline measure of all their different measures of their heart and that sort of thing. And then we provide a comprehensive periodontal treatment for the participants. So we give their mouths a full clean-up, and then we measure them again at 3 months and 12 months and just see if there's been any changes in their cardiovascular risk markers.
National figures show Indigenous Australians report 30% more periodontal disease than non-Indigenous Australians. Early data from this survey paints a more dramatic picture, with 3/4 of the adults screened having periodontal disease.
Yeah, excellent. Right?
What we found is that a high proportion of Aboriginal folk up in the Northern Territory do have cardiovascular disease, and there's some evidence in the literature which suggests that periodontal disease or gum disease has some links with cardiovascular disease or heart problems.
So here I'll show you some really good foods. These are ones that we can eat all the time. Good for our body, good for our teeth.
The focus for these children is on prevention. The school-based brushing program has already led to improvements in oral health, and it's a good habit that children are helping to spread throughout the community.
They're really excited because at the end of the term they'll get to take their toothbrush and their toothpaste home for the holidays.
We think toothbrushing in schools is a great opportunity to try and develop a habit that could last throughout a lifetime. It's an important time in the development of the children's teeth. It's often when their permanent teeth are coming through, and they're the teeth that they're going to have for the rest of their life.
Letitia Lemke with that report.